OK, back to Victoria and this climate of fear or revolt, depending on who you talk with. The daily infections numbers have scared the willies out of all of those already nervous Nellies in places like Queensland, South Australia, the Northern Territory and, of course, WA. To some of those premiers, those characters shortly. But this was Chairman Dan again today, not having a shot at families as much as he did yesterday, but almost admitting that the department's tracing and testing of certain clusters has been a failure.
We had low-level chains of community transmission that we were not necessarily aware of. Now, the fact that we weren't aware of that, even though we did a testing blitz of a best part of 175,000 tests, just makes the point. Unless you test every single Victorian at the same time and then somehow get the results of those tests at the same time, you can never have a total and complete picture of how much community transmission, how many, albeit isolated, chains of transmission are out there in the Victorian community.
That we weren't necessarily aware of. In other words, they dropped the ball. Similar to the Ruby Princess, they knew there could have been further transmission, but they dropped the ball. They didn't go far enough. But we don't want to highlight that too much. Just before I came on air, I caught up with the state opposition Liberal health spokesperson, Georgie Crozier. Georgie Crozier, thank you very much for your time.
Good evening, Chris.
You, more than anyone in Victoria, would have kept a close eye, especially on a health policy basis, on exactly what Dan Andrews has been doing. There have been red flags across the way he's handled coronavirus right from the get-go, hasn't there?
Absolutely. In Victoria, we were not testing at the very time when our numbers in March were peaking, the number of cases, and we weren't doing the tests. So there have been red flags all along. And yet the government was just silent on this. They actually didn't do the necessary testing that was required at that point of time. So we probably don't know the true rates of community transmission.
Yeah. So let's put that aside. They didn't jump on the testing protocols early enough. What about when it came to clusters and Cedar Meats in particular? We find out today that some of these families that have been infected are related to those that were first infected at Cedar Meats. What happened to proper transmission tracing? That obviously wasn't done properly.
Well, that is a very good case sample of what has actually occurred in Victoria. And the issue around this is that this is Victoria's biggest cluster of 111 people that we know of. And now we've got possibly these sub-clusters from Cedar Meats. And the government themselves said it was, the Minister herself said it had been handled absolutely perfectly. And what's more, she was absolutely dismissive of the concerns of those people who were working at Cedar Meats, who were working directly across the person who, the second case, weren't tested for 8 days. I mean, this is a failure of that contact tracing. And indeed, Chris, if you can believe it, she said, the Minister said, that there was no way the virus could have gone from the first case unless it got into a car and got to Cedar Meats. But we know through the genomic testing that there was a link. So this is a direct failure of government, and in terms of that very important element of the contact tracing that you spoke of.
And then, unlike other states and territories, we have had in Victoria a real leaking from quarantine hotels. In 2 occasions, you've got major hotels in Melbourne where, you know, self-isolated people were being kept and living. We've got staff in 2 of those major hotels that have then been, you know, infected and taken it out to the community. That hasn't happened to the scale that it's occurred in Victoria anywhere else in Australia.
Well, that's right. This is another failure of government. And even those security guards will say, we didn't get the proper training from government and we didn't have the proper PPE. So as you say, we don't know the full transmission, whether the security guards, whether those breaches and the infection control, the cross-contamination has occurred with security guards with travellers or back into the community. And again, we've got no real way to be getting these answers from government, who just are shutting down all of this information and being really open about it. And we need to, because as you say, it hasn't happened in other states to the extent that it has happened in Victoria. And it is as a direct result of the government's mishandling of these very serious issues.
The other peculiar and unique way in which they locked everyone down was the fact that Victoria went to Well, virtually the nth degree. It was a bit more than just a partial lockdown. You couldn't even play golf, and that's the sport that is probably the best self-isolation sport you could ever think of. He went so hard and suffocated the people of Victoria that is it any wonder that in 8 weeks beyond all of that, people have sort of gone, no, I'm going by my rules, I'm going to revolt, I've had a gutful.
You're right. People stopped listening. They heard what the Premier was saying. We had the toughest restrictions here in Victoria, as you said, and the Premier himself said, you know, I'm not playing golf, it's not worth somebody's life. Or the issue around Mother's Day. You've got to be cautious, and 2 days, don't visit Mum on Mother's Day, and 2 days later you're allowed to. But the worst thing was the green light to the protesters.
Yes.
So people stopped listening because they said, there's one rule for them and another for us.
Yep.
Forget it.
Yeah, let me ask you questions.
Nothing.
As I said, you would be watching exactly the move that every one of those senior bureaucrats and, of course, the Health Minister was taking along the forum. Did they meet with protesters to try and dissuade them from gathering? Was there any meeting between, you know, the protest organisers and government?
Well, I asked the Minister this very question in Parliament, Chris. I asked the Minister, had she met with the Indigenous leaders to say, please don't do this, please don't go ahead, because you are one of the most vulnerable cohorts. And I got this waffle, and it was clear that no, she hadn't.
No.
So the very people that you would expect them to be saying, please don't do this, you are vulnerable.
OK. Did they go to the Supreme Court like the New South Wales Police Commissioner did and try and get it overturned legally?
No, they didn't do that. There were options the Premier and the government could have done. They didn't do that. They were very weak towards the end of the week and said, please don't go. They could have had so many options to send the message and the no fines of these people. They could have blocked public transport, or they could have asked them to protest in a way like we all did on Anzac Day, stand there and, you know, make our respectful acknowledgement of Anzac Day in our own way at the bottom of our driveways across Australia. It was a very powerful, moving experience for many of us.
Yep. And the Premier also took the weak way out. We had a situation in New South Wales where on the second Black Lives Matter protest, they sent a swarm of police out. There were thousands of police, which forced the protesters to disperse to another part of the city, which deleted their numbers. And then we had a situation where it was called off and they all went home. That was not attempted in Melbourne, in Federation Square, was it?
Not at all.
Right.
Not at all. In fact, it was the Premier gave the green light for this protest to go ahead, and of course we had 10,000 cheek to jowl, and we've got 4 known cases of coronavirus, COVID-19 with those protesters. We will never know the true extent of it.
You know, one of the most common aspects of fighting this coronavirus among the countries around the world that have had success is to target the vulnerable. And when I mean vulnerable, the clusters as well as older people. And right now Beijing has had a second wave. They have literally shut down entire precincts, in other words, small suburbs, to make sure that those people are locked away. They don't travel, they don't go to other parts of the city or don't go interstate. This is exactly what he should be doing today, isn't it?
Well, there's talk of, you know, these hotspots across Melbourne where we've got these outbreaks. If he's really serious about this, he's going to have to do what it is needed to be done and to stop this rise of cases. We've got our economy that needs to open up, the mixed messages that's been given to business, the stop-start of a terrible disappointment and, you know, livelihoods that are just going by the wayside. So he needs to be really proactive and stop thinking about himself in terms of their woes and really get on top of this, because it's clear that Daniel Andrews and his government's dropped the ball. Yeah,
they've dropped the ball badly. Georgie Crozier, thank you very much for your time. All the best.
A pleasure, Chris. Thank you.